It was last summer. I do the big mow.
We were doing 4 miles at Lake Shore almost every day.
Yard looks tremendous.
She just basically face planted in front of me.
And so you get the pain, and I'm thinking, boy, is it this?
I was just a normal person living my life, doing everything I thought was right, and yet it happened to me.
So I was pretty much, and have been aware, heart disease is in my family.
She went into sudden cardiac arrest.
I said, I think I'm having a heart attack.
My name's Judy DiStefano, and I'm married to this wonderful man, Mike DiStefano, and we just celebrated 40 years.
We had decided that I would come home a little early that day, thank the Lord, and we would go walk at Lake Shore Park, and then I heard a very faint call of my name. And about the time I got with her, she just basically face planted in front of me. I also saw the vacant look in her eyes, and I knew she was in trouble. And so I started performing CPR. Every medical professional that we talked to basically said she was not going to survive. There's no way she was going to survive. She had clean arteries. She had no underlying issues. Her valves were good.
We believe that she had a syndrome called long QT syndrome. In her case, it is something that she probably was born with. We made the decision as a team to put her on what's called a hypothermia or a cooling protocol in an effort to protect her neurologic function.
I don't remember anything about being in the hospital or coming out of the coma or any of that. I have pictures and I have videos of me getting up for the first time and trying to walk, and I look at those things and I think, how did this happen to me? You know, one thing I've learned is to just be grateful for every day I get to be alive.
My name is Phil Williams. I do a talk show. I've been in radio since 1977 in Knoxville. My family history is pretty dark. My dad dropped dead with his third heart attack at age 42. My grandfather at 51. My grandmother at 63. In rock and roll, you thought you were bulletproof. And then you come to find out, oh boy, maybe I'm not. My first heart incident, I had open heart surgery in 2005. And then you fast forward about 20 years. And I had, it was last summer. Boy, mow the yard and it's hot and I'm sweating. Then I put the backpack blower on, and so you get the pain. And I'm thinking, boy, is it this? I knew I was having a heart attack. You know you're having it. Don't ever hesitate. Don't ever hesitate, because what if it is? But you know something? I'm in the ambulance, and I don't remember, I guess they gave me a drug. And I thought, oh gosh, I'm going to wake up, I'm going to see God. Yet I saw Dr. Todd.
We get you in quickly, we get these stents in. Those stents now have very low rates of re-narrowing due to that drug coating. Only 3 to 5% of the time do we ever have to redo our work with stents.
The research I think the Heart Association does has certainly been bearing fruit in the quality of our life.
And patients do really well. Heart attack's just a little bump in the road nowadays. Because of the American Heart Association.
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 Patients now have better quality of lives, better longevity of lives, and more time to spend with their friends and family.
Patients like my dear patient Judy have life.
I'm alive today.
I'm alive. Somebody you know is probably alive.